Hello, welcome back to the Health Review. Thank you for joining me again. I'm, as you can see, all on my own this week. I'm going to be bringing you some of the latest health news stories that caught my interest recently, and I want to share them all with you. From new science on how long COVID is affecting women's health, a futuristic look at robotic sperm, very interesting, AI tools shaking up healthcare, lifestyle tweaks that could save your life, and even the surprising science of saying sorry. That one's very curious. So let's dive in. A new UK survey of over 12,000 women has uncovered a striking connection between long COVID and menstrual health. Women living with long COVID are reporting heavier periods, bleeding between their cycles, also changes in the severity of their symptoms depending on their cycle. Obviously, this isn't just inconvenient, it can also lead to iron deficiency over time, and that worsens the fatigue, brain fog, the shortness of breath. Symptoms which are already common in long COVID can be made much worse if you're also iron deficient. I've got friends who've been suffering with iron deficiency recently, and it is awful. It makes you feel exhausted. The brain fog can be really troubling. So adding that with long COVID could be very problematic for a lot of women. What's important here is that menstrual health hasn't been on the radar in long COVID clinics until, well, around now. We've heard that doctors are often looking at heart health, lungs, fatigue, but rarely about reproductive health. And experts are now saying that simple steps, just like tracking your cycle, testing your iron levels, could make a real difference to avoid any further brain fog and low energy. And it's also just a reminder that women's health needs to be fully integrated into every area of medicine, not siloed off like it has been for a long time. So what about you? Have you noticed changes like this since COVID? I think a lot of people have, but it's hard to say whether it is COVID or whether it's other things. You know, I definitely have spoken to many people who've said, oh, my periods are much worse than they used to be. But that could be, you know, hormonal changes. It could be age. It could be, you know, sometimes it happens after you have children. So it's unclear. If you have been affected after COVID, you're definitely not alone. And your story could help push this conversation forward. And it's obviously a great idea to speak to your healthcare provider if your periods have got worse since COVID. Now to a headline that sounds like science fiction: robotic sperm. Very interesting one. Researchers in the Netherlands have developed sperm cells coated with magnetic nanoparticles. This means they can be guided with magnets and even visualized in real time as they move through models of the female reproductive system. The potential here is obviously huge if this works out. It could open doors for couples with unexplained infertility, where perhaps they've been through traditional IVF cycles that haven't worked, by literally just steering sperm to where it needs to go. Scientists are also exploring whether the cells could deliver drugs directly into the body, which would be really, really interesting. But obviously this is very early at the moment, and there are still questions about this. How safe are these nanoparticles? You know, would you feel comfortable putting nanoparticles in your body? How will regulators look at this? It could be difficult to get approval for. And what does it mean for the industry? You know, if IVF treatment like this starts happening, what happens to traditional IVF as well? For now, it's just being tested in lab models, not in humans. But I think it is a real glimpse into the future of fertility science. So it's an exciting development. And obviously watch this space for that one. To something that is actually happening right now, women are leaving the contraceptive pill in record numbers, not just because of new science, but because of what's happening on social media. A Sheffield University study found that online misinformation is fueling what's being called the nocebo effect. That's when people develop side effects simply because they are expecting them and they're not necessarily actually there. The numbers are also quite alarming. Pill use in the UK has dropped from 39% in 2020 to 28% in 2024. That's quite a drop. Of course, we know the pill does have risks, but decades of research also show that it is quite safe and effective for most women. The problem is that obviously influencer culture can amplify fear if you don't have that balance also in place. And it can be scary. If you hear someone speaking on TikTok, on Instagram, a lot of people are turning to social media, sharing their stories. If they've had an adverse reaction or a blood clot, obviously, if you see that, it can be alarming. Experts are saying the solution is clearer communication, acknowledging the risks, but also explaining the benefits as well. Otherwise, millions of women could end up with unplanned pregnancies because of some of these things being said on social media. So I'd love to hear from you. Has online content shaped your choices around contraception at all? Personally, I actually did take the pill for a long time, and it helped me also with clearing my skin, which was a huge bonus. But I did get side effects as well, which weren't ideal. And it's been really interesting in recent years for me. I've been working on getting my cycles naturally and balancing my hormones. That's still something I'm trying to do now, improving things like gut health, detox pathways. But it obviously is a very, very useful tool for many women, and for the most part can be very safe. This one might change your opinion on the term midlife crisis. So in a new survey study published in PLOS ONE, researchers analysed happiness and well-being scores from tens of thousands of people across multiple countries. For decades, economists and psychologists have pointed to what they call the U-shaped curve of happiness. People feel relatively content in their youth, then they hit a slump in midlife before happiness rebounds in later years. But this study actually suggests the midlife dip may no longer exist. That's right. Instead, younger adults, particularly those under 35, are reporting lower levels of happiness, higher stress, and poorer mental health than people in their 40s and 50s. The reasons are obviously quite complex as well. We've got financial insecurity, the ongoing housing crisis, the pressures of social media, and just the general sort of global uncertainty. All of these are playing a role in this. And for women, this could mean that what we used to call a midlife crisis may actually be shifting earlier, with millennial and Gen Z women facing stresses that their mothers didn't. Obviously, the cost of living struggles, the online comparison culture, which I think a lot of us are very familiar with. And it's a reminder that our assumptions about when life is hardest may actually now be out of date as things are changing. And the support services need to evolve to meet younger people where they are right now. I know there's lots of investment going on into mental health support for younger generations, for Gen Z. There's been lots of studies and surveys about depression among Gen Z. And I think this is a really interesting topic. It's an interesting survey study, actually, because it just highlights that things are changing and young people are certainly having a much more difficult time than they used to get that stability, which clearly does bring happiness and mental stability, which is really important. A new study from Scripps Research shows that everyday wearables like Apple Watches and Fitbits may soon transform pregnancy care. By tracking heart rate, temperature, sleep, and activity, these devices can pick up subtle physiological changes that align with hormonal shifts in pregnancy. Researchers say the data could one day detect complications like pre-eclampsia or gestational diabetes earlier than the current methods that are already out there. I haven't had kids yet, but I can imagine that wearing one of these, which could give you an alert before any condition becomes dangerous, could actually be quite reassuring. I know a lot of women go through a lot of anxiety. You hear women doing extra scans, going to doctors, A&E, if they feel something's changing, and perhaps wearing a wearable like this might actually be a reassuring step. I think it could especially be helpful for women in remote or low resource settings. Could be even life-saving for them. Again, still early stage in this research, but it shows how consumer tech is edging closer to serious clinical use. It's getting really close now. But it also asks us, how much of our health are we actually willing to monitor in real time? Who knows? Maybe one day we will all be microchips and wearing lots of wearables. So from pregnancy monitoring to a new twist on one of medicine's oldest tools, the stethoscope. Researchers at Imperial College London, working with Echo Health, have created a digital stethoscope that doesn't just listen to your heart, it records an ECG, captures heart sounds and then uses AI to detect problems like heart failure, atrial fibrillation, and valve disease in just 15 seconds. That's amazing. Imagine the impact if you were in a GP surgery where obviously there are long waits for specialist testing, appointments, all of that can delay treatment. So this could be really useful just to get a very quick kind of look at your health. But there is a caveat that often with new technology, there are false positives. That is still a risk. So it's not yet a screening tool for the masses, but very much could be in the future. Another AI success story comes from Sarah, a UK company helping carers and nurses monitor older patients at home. Their app records vital signs like blood pressure, sleep, temperature during the visits, and uses AI to flag issues before they escalate. We know that prevention is obviously the main goal. It's very important. And according to reports, it could even be saving the NHS about £1.5 million per day by preventing avoidable hospital admissions. That's amazing. It shows the power of, simple preventative monitoring. And with an aging population like the one we have, keeping people safe and independent at home could transform their lives, but also healthcare budgets as well, which we know are very, very stretched. It's not glamorous technology, but it is very practical. And I think sometimes that's the real kind of revolution. That's where the change will happen. So fingers crossed for that. Let's now turn to something very simple but powerful. New research from Hong Kong and the UK suggests that people who walk at a faster pace have a significantly lower risk of developing lung cancer. We already know brisk walking is good for your heart health. That's a well-known fact. But linking it to lower cancer risk is new, and it shows just how daily habits can play a bigger role than we think. Those small habits, they really build up over time and can make such an incredible difference to your life. This study proves that. The beauty is the simplicity in this one. You don't need a gym membership or an expensive device. Just upping your walking pace could make a measurable difference. So that's great news. On to another one, which is quite an interesting little story. It's not necessarily health-based, but I thought you might find this interesting. A quirky but surprisingly practical new study has found that longer apologies come across as more genuine. Psychologists ran experiments where participants read or heard apologies of different lengths. Those who received longer, more detailed apologies consistently rated them as more sincere, more trustworthy, and more likely to repair a relationship. In fact, even when the person apologizing didn't actually do anything wrong, adding extra sentences about regret, making amends, boosted the perception of sincerity. That is so fascinating. So if you've ever wondered why a quick, "Oh, I'm sorry about that," didn't quite land, this research suggests it's worth taking an extra 20 or 30 seconds to expand. Maybe a few more words of explanation or reassurance that you'll do better next time could make all the difference. And in a world where texts and emails often make us sound a little bit distant, perhaps a little bit short sometimes, this is a small but powerful way to really strengthen trust with people. I love that. I'm going to definitely try that next time I'm in trouble. I've done something wrong. I'll do a nice long apology. Finally, let's zoom out now to health and wellness as a whole. NIQ has just released its Global State of Health and Wellness 2025 report based on surveys of nearly 19,000 adults across 19 different countries. The top priorities people reported were nutrition, weight management, and mental well-being. More than 60% said they were actively trying to eat healthier, which is great, and nearly half said they were cutting back on processed foods, which is a topic we've been talking about a lot on the podcast recently. Wearable health technology is also on the rise too, with a 20% year-on-year increase in people using fitness trackers or smartwatches to monitor their health. And consumers are becoming more conscious buyers. Around 40% said they prefer health products from brands they trust for transparency and sustainability. That's really fascinating. And what's striking is that these trends are consistent across regions. Europe to Asia to the Americas, people everywhere are trying to take more control over their health. Often outside of the traditional healthcare system, holistic ways, For women in particular, this means relying not just on doctors, but also food choices, looking at that full picture, technology, trusted information to feel well. This is really good news. It's a powerful reminder that, the health conversation is just as much about lifestyle and consumer choices as it is about traditional medicine, hospitals. And it's something I'm very invested in. You'll know on the podcast, lifestyle, diet, sleep. There are so many things we can do for ourselves. And, with this podcast, I want to be part of that education tool. So hopefully if you're a regular listener, you've learned many, many ways which you can improve your health. And it seriously sounds like things are moving in the right direction. We are more health conscious now, which is fabulous news. That's what we like to hear. So that is all for today, from AI stethoscopes, robotic sperm, to the way we're walking, even the way we apologize and also track our well-being. Health, we know, is changing fast and in surprising ways. Thank you so much for joining me for the health review today. Let me know which of today's stories struck you the most, if any of them did. Drop me a DM, Instagram, TikTok. Also say hi on YouTube. And we will keep exploring all of the evidence behind the headlines. I will be back next week with a guest, usual format next week. Look forward to seeing you then.